Randomized controlled trials are the highest bar, the last test for any medication to pass. And in this case, again, we have randomized controlled trials asking the question, is ivermectin good at treating COVID? And again, the answer is no. It's been tested every which way in patients who are not yet hospitalized to see if it keeps them out of the hospital. It doesn't. It's been tested in patients who have mild COVID. It doesn't help them. It's been tested in patients who are already hospitalized, and it doesn't help them. It's pretty clear that the evidence is pointing towards the fact that it doesn't work. Now let's see what Robert says. He starts off like most ivermectin proponents do by talking about how great it is, and it is a really useful drug. It genuinely is one of the most necessary and useful drugs in the world right now. But its usefulness comes from the fact that it's really good at treating parasitic infections. It is not great at treating viral infections. They are two completely different things. Robert continues to talk a lot in this section about Dr. Pierre Kory, who, as he mentions, testified in front of Congress in 2020 about how supposedly useful ivermectin is against treating COVID. In his speech to Congress, he claimed that ivermectin obliterates COVID from the body and that it is a miracle drug in this context. At the time he was saying all of this, no randomized controlled trials had been done, and hardly any studies at all about ivermectin and COVID had been completed. But that didn't stop him from making these wild claims in front of Congress. I made a video after he did that, saying that it was irresponsible of him to make such bold claims before we have all of the data. And the fact that he didn't wait for all the data has come back to bite him, because he continues to double down on this idea that ivermectin works. In fact, he's made it a living. It's to the point where he's charging $1,250 for patients 18 and up just to consult with him. And yet he has the gall to claim that other doctors are making a living lying about ivermectin. Wow. So anytime that Kenny talks about Pierre Kory in this book, know that Pierre Kory is not a doctor for people, he is a doctor for money.